Hello and welcome back to our channel, where we unravel the mysteries of the human body and delve into the fascinating world of medicine. Today, we're talking about deep venous thrombosis, or DVT, specifically its implications in the lower limb. But first, if you're new here, don't forget to hit that subscribe button and turn on notifications so you never miss an episode. Now, let's get started. Although mesenteric veins and upper limbs can develop thrombosis, the most prevalent type of venous thrombosis is deep vein thrombosis. Most deep vein thrombosis is occult and goes away on its own without presenting with any complications or signs. Deep vein thrombosis is a presentation of venous thromboembolism. The most lethal side effect is pulmonary embolism. Speaking of the venous anatomy of the lower limbs, the peroneal veins, posterior tibial veins, and anterior tibial veins originate from the calf. Additionally, the intramuscular venous plexuses of the gastrocnemius and soleal connect to the peroneal veins. These tibial veins unite to form the popliteal vein just below the knee. Against gravity, these systems force blood upward from the feet. As it approaches the thigh, the popliteal vein transforms to the femoral vein. The common femoral vein, which ascends to become the iliac vein, is formed by the union of the proximal thigh, the femoral vein, and the deep femoral vein. Forming of venous thrombosis, Virchow's triad has been used to explain its pathophysiology. Venous stasis is where there is slowing or obstruction to the flow of venous blood. Hypercoagulation is where there is an imbalance between clotting factors and anti-clotting factors leading to increased clotting risk. Vein damage can be intrinsic or secondary to external trauma. It may result from accidental injury or surgical insult. Thrombophilias such as factor V Leiden, prothrombin gene mutation and deficiencies of protein C, protein S, and antithrombin, or acquired conditions such as antiphospholipid antibodies. Fracture of the hip or lower limb, hip or knee replacement surgery, major general surgery or trauma, arthroscopic knee surgery, hormonal therapy such as oral contraceptives, hormone replacement therapy, pregnancy, paralytic stroke, previous venous thromboembolism. Immobilization, obesity, advancing age. Polycythemia rubra vera, thrombocytosis, or dehydration. Malignancy, acute infectious diseases. Matherner syndrome or Cockett syndrome. Limb pain or tenderness, this can occur on dorsiflexion of the foot called the Hohmann's sign. Limb edema. Superficial thrombophlebitis is characterized by the finding of a palpable, indurated, cord-like, tender, subcutaneous venous segment. Variable discoloration of the lower extremity, reddish-purple. Massive venous obstruction can cause cyanotic limbs. If a patient develops pulmonary embolism as a complication, they can present with sudden onset of pleuritic chest pain, shortness of breath, and hypoxia. Electrocardiography may demonstrate ST segment changes. Can use ventilation/perfusion lung scanning to diagnose. The gold standard for diagnosing pulmonary embolism is pulmonary angiography. A chronic consequence of deep vein thrombosis is post-thrombotic syndrome, which appears months or years after the initial incident. Mild erythema, localized induration, significant swelling of the extremities, and ulceration are among the symptoms. Important lab tests that need to be done include D-dimer assay. This test is nonspecific as raised in many conditions with clots, so can be used to rule out DVT. A positive result requires a diagnostic study, such as duplex ultrasonography. Coagulation profile. Levels of antithrombin 3, protein S, protein C, factor V Leiden, antiphospholipid antibodies, and homocysteine levels. N-terminal probrain natriuretic peptide. C-reactive protein. Erythrocyte sedimentation rate. Imaging modalities include: ultrasonography is the first line. Venography is an invasive procedure but is the gold standard. Others include impedance plethysmography, magnetic resonance imaging, and nuclear imaging. Wells's clinical prediction guide is used to classify patients according to the risk of DVT. This, along with other investigations, can be used to decide the management plan. The guide consists of risk factors, clinical signs, and the presence or absence of alternative diagnoses. Anticoagulant therapy includes direct oral anticoagulants, warfarin, or heparin. They can be used for prophylaxis also. Endovascular intervention includes catheter-directed thrombolysis, mechanical thrombectomy, angioplasty, and stenting. Surgical thrombectomy is used for extensive thrombosis. Inferior vena cava filters trap venous emboli and maintain venous flow. Below-knee elastic compression stockings can assist the calf muscle pump and reduce venous reflux. As we wrap up today's exploration of deep vein thrombosis, I hope you've gained valuable insights into this complex condition. If you found this video helpful, give it a thumbs up, share it with others, and don't forget to subscribe for more engaging content on various medical topics. Thank you for joining me today. Until next time, take care and stay well.